The head of one of the nation's top cancer treatment centers is voicing support to raise Texas's legal smoking age to 21. Dr. Ronald DePino, president of the University of Texas MD Anderson Cancer Center in Houston, spoke at Wednesday's University of Health briefing in the TMA building. He said raising the minimum legal smoking age in Texas would save lives and have positive social and economic impact. The initiative, called Texas 21, would raise the legal age from 18 to 21 to smoke and possess tobacco products. Dr. DePino told the audience of mostly legislative staff members that raising the legal age could save countless young Texans from illness and save billions of dollars in tobacco-related health care costs.
About $9 billion in direct health care costs to tobacco use in Texas, $9 billion in lost productivity. Of the direct health care expenditures, $1.9 billion in Medicaid expenditures. And as we all know, with tobacco, the use is much heavier for those that are struggling, and so the Medicaid population is particularly vulnerable, and so there would be a disproportionately positive impact on that segment of the healthcare ecosystem.
T21 is backed by TMA and the Texas Public Health Coalition, of which TMA is a member. That University of Health briefing, presented by the Texas Public Health Coalition, also featured a discussion about how to pay for the state's public health needs. Top physicians, including the current and two former Texas health commissioners, noted the state faces a tight budget this session. That leaves many public health advocates wondering what impact potential cuts might have on the Health and Human Services budget and in Medicaid funding.
We're going to be really hurting ourselves in the intermediate and short term if we don't make important investments in public health and just cut them as if you can cut 4% here and not maybe realize a 50% jump 3 years from now in what was a cost that was under control.
This is my first budget session as commissioner, so maybe I'm kind of overly optimistic, who knows? But I don't think so. I think in the end, people, our leaders will understand the value of public health, and they will essentially give us what we need to carry out our basic and absolutely necessary functions.
Public health physicians from Austin and Houston added cost reductions to the state budget would also affect their ability to provide services at the local level.